Good afternoon, everybody. My name is Jay Shorr, and thank you for joining Shorr Solutions, the webinar. Today is Thursday, and June 18th, 2020, and I would like to thank you for attending. Today, I have a special guest, Dr. Michael Kurzman from Staten Island, New York. What I'm going to do today is give a brief bio of Dr. Kurzman, the history of how I met Dr. Kurzman, the history of our physical engagement, and I'm going to ask him a series of questions. This is going to be a dialogue basically between Dr. Kurzman and myself about an insurance-based practice and the state of COVID-19, how it affects his practice, the state of his practice in general, and how we think we're going to move through our new, and I don't want to say the new normal, I always like to say, if you've heard me on many times, how we're going to move through the normal, because every day is a new normal and it's an ever-changing society for one reason or another. And we're not going to really get interested in why that occurs. But what I'd like to do is give a brief biography of who Dr. Kurzman is. So it's very interesting that Dr. Kurzman is a well-respected board-certified dermatologist practicing in Staten Island. It's near Rossville and Pleasant Plains. From his offices, he specializes in the treatments of skin conditions, including acne, psoriasis, mole removal, hyperhidrosis, and offers anti-aging treatments involving Botox and fillers. Dr. Kurzman earned his medical degree from New York Medical College in 1980. I don't know if he wants me to say how far back.
That's fine. That's okay.
After completing his undergraduate education at the Yeshiva University, his postgraduate training, including an internal medicine internship in the residency of Maimonides Medical Center and a dermatology residency at New York Medical College. A diplomat of the National Board of Medical Examiners, Dr. Kurzman is a board-certified dermatologist by both the American Board of Internal Medicine and the American Board of Dermatology. In addition, he's also a fellow of the American Academy of Dermatology. Dr. Kurzman was a clinical assistant professor in the Department of Dermatology at New York Medical College and is a co-director of the Division of Dermatology at Staten Island University Hospital. Dr. Kurzman has been in practice since 1986, serving Staten Island and the surrounding area, and is dedicated to helping patients enjoy youthful, healthy skin. Dr. Kurzman's practice offers a combination of medical dermatology and cosmetic skincare treatments, and his approach to medical and cosmetic dermatology is the same. He collects as much information as possible, discusses possible procedures, and moves forward with the most straightforward solution tailored to your particular needs and concerns. Dr. Kurzman works closely with each patient to develop an individualized plan of treatment and strives to make your experience easy and comfortable. So, together, as ever, as one, Dr. Kurzman, as I always like to hear from Chris Cuomo, let's get after it.
Absolutely.
Okay. So one of the things, if you could explain briefly our engagement, our initial engagement of how we met.
So I had the great fortune several years ago to attend the conference with down in Tampa with the Smile Doctor, Dr. Castellano, Rich Castellano, and you and Mara were there and presented and had a phone call with both of you. And, I've been doing this on my own for a lot of years. And as much as I thought I sort of knew what I was doing and things were running smoothly, I really needed some additional help. And we engaged initially. It was sort of a little bit of a trial, I believe, in the beginning, but very quickly we moved forward. And you guys have really just, you and Mara and your entire team, I should say, have really assisted my practice and me personally, just to make my life easier, more productive. So, it's been a great few years together, and I appreciate it.
With that being said, how did it affect when you first met us? I'm trying to get the video back here now. Pardon me.
Sure.
When we first met, what made your decision once again to start and actually get involved in working with a consultant, there's so many people out there today that promise you the world, the moon and the stars, and you never really know what is the best opportunity for you.
Correct. And, it's sort of hard to know. You get a feel. I would say, as I said, Rich Castellano was somebody who I had known previously. I had some dealings with him and really trusted him. And, he spoke glowingly about you. And so that in and of itself was very helpful. And I knew that I wanted to grow my cosmetic practice, and I just didn't have the resources available. I didn't have the time. And so it just seemed like a good fit. And both you and Mara and team were just so easy to get along with, and you had great ideas. And it sort of made sense to me, and so I figured, let's give it a shot. I needed the help, and you were there. And, it's sort of, I haven't looked back,
Wonderful. When did you first officially get into dermatology?
Oh, well, I started my residency in 1983 after I did 3 years of internal medicine, and I had no plans of becoming a dermatologist until one split second where I just had this epiphany. And fortunately, I was able to get into a residency program, and it's been wonderful. Dermatology allows me to do both medicine, surgery, and of course, back then we didn't have cosmetics. That was a whole different story when I first started. So it's just
Right.
evolved. Yeah.
What is that epiphany that made you decide that you wanted to get
I'm
into
almost
dermatology?
embarrassed to say I had a particularly bad and stressful day in a medical clinic as a third-year resident. And I just said, I do not want to be doing this type of medicine for the rest of my life. And I said, all right, let's try dermatology. Having no knowledge about it, I know this is not what you're supposed to say about how you pick a specialty. But once I got involved, it was a whole new world for me, and just wonderful.
Right.
Yeah.
Did you officially want to get into clinical derm knowing about insurance? Because back then it was
Right.
a wonderful experience.
Yeah, I mean, that's all there was. When I started, everybody was still in private practice doing medical dermatology. I think the only cosmetics, collagen had just come into the marketplace and been there for a few years. So there were some collagen injections, lasers were just starting. Unless you did some, hands-on surgery, cosmetic surgery. Dermabrasion was being done, but, some hair transplants, but it was really in its infancy. And the truth is, I'm still a relic because I'm still a solo practitioner, which you don't have anymore. Again, why I need the help. And that's what I expected to do. I expected to do medical dermatology, some surgery. I enjoyed it. It was wonderful. So,
How did you not get swallowed up by the big conglomerates, the big groups, the hospitals, because you are a relic? That
right,
doesn't happen anymore.
I say no. It's not what I want to do. After sort of being my own boss for so many years, the thought of working for somebody telling me how I should practice, when I can take my time off, it just doesn't appeal to me at all. And the truth is, getting back to Rich, Dr. Castellano, I had spoken with him about this, and periodically I get threatened by the large groups. If you don't sell to us, we'll open up right down the block and you'll be out of business. And he said to me, look, you still, Maseratis are still being sold, and, Porsches are being sold because that's what they are. He goes, you're a superstar. Don't worry about them. You're the Maserati, you're the Porsche in your area. Let them come. And it's true, so, I just, it's not something that I ever wanted to do. And I'm very happy I never did.
That's wonderful. So share with me then what finally got you in, because there's a whole list of questions that I'm going to want to ask
Mhm.
you.
Sure.
But in clinical dermatology, and as you well know, and many of the people that know me know that dermatology is my passion. I come from initially emergency trauma background. And for the matter of a disclaimer, when I speak about where I came from and the practice that I was a partner in, I want to make a disclaimer that I am not a physician. All right. Because many times when I speak about my former practice and being a partner, I don't want to give off the aura to people who are listening that I'm a physician. All right. I stayed at a Holiday Inn Express one night, so I don't know if that qualifies me at all.
There you go.
However, I've been in medicine my entire adult life. However, dermatology is a passion for me because I was a partner in one of the larger dermatology, cosmetic, facial body plastic gynecology practices here in South Florida back in 2011. It's almost 9 years ago that the medical director had been diagnosed with stage 4 cancer. And in June of 2012, she lost her battle. And I had to end up dissolving of the practice and selling of the practice. I was the partner and a practice administrator. It happens to have been, for those who know my story, that the medical director, dermatologist, was my late wife. So, since that time, my daughter and I, pictured below Mara, we took this to a side hustle and ended up wanting to work with medical practices to help them with their operational, administrative, and financial health of medical practices. So dermatology is truly my passion. But what made you decide to have a transition from clinical dermatology, the basal squamous cell actinic keratotic lesions, dermatologic surgery, to cosmetic, even though you still are very, very heavily involved in the derm guy? All right.
Yes.
And look, I applaud, because there were always some people that get really turned on by derm because you help a lot of people. And when the old expression, I am itching out of my skin,
Right.
it is a fact.
Oh, yes.
Rash, you are freaked out. You are literally itching out of your skin that even diphenhydramine can't cure.
Correct.
I
Yes.
got to come to
Right.
okay.
That's when we got the call.
What made you decide to make a transition even into cosmetics?
Yeah, well, it was sort of what the whole specialty has been transitioning over the years, and I guess you want to keep up with it. Certainly, there were, financial considerations, and also it's just a matter of trying to do new things. I love everything that I do medically, but it's the same things, and then suddenly there's a whole new focus in our field that we can get involved in. It allows us to think of our patients differently. It allows us to be artistic. And, patients ask about it all the time, and we want to keep everything in-house. For me to say, well, I'll take off your skin cancer, but go down the block for your injection, doesn't seem to make a whole lot of sense. We do everything. That same patient who gets their skin cancer also gets their cosmetic treatment. And, it's just added a whole different dimension to the practice. It started doing that early on. And plus, it allowed me to go to, or I chose to go to, additional conferences and training seminars. So it just became very interesting to me. You have to think about things in a very different way. So,
Yeah, we're going to get to the
yeah.
conferences in a little bit.
Sure.
What a change of life that is.
Oh, my goodness. Yeah.
It's almost like whether, yeah. So when did you officially um, temporarily shut down? Because, as we all know, a lot of this pandemic is state driven. Some states still aren't allowed. Some opened up early, like Texas, then Florida
Right.
was to follow. And when did you officially, because I know your governor, Governor Cuomo, is very aggressive.
Yes.
You had a lot of cases in your state. I don't
Oh,
want to get into any of the politics behind this
yeah.
because that's not what this is about. But when did you officially shut down? I'm going to follow it by
Sure.
when did you come back for
Mhm.
what I consider critical, and then elective and non-elective.
Sure. So we officially shut down the third week of March. Personally, I stayed away the week before. I wasn't feeling well. I did not have COVID, and my physician said just stay home. Although our office was open, our physician assistant still saw patients that week. But we knew people were canceling. We just heard what was going on, and we said, look, we're just going to shut down. It doesn't make sense. And so the third week of March, we officially closed our office.
And then when did you get the notice that it was okay to open, and for what procedures did you open?
Yeah, so I don't know necessarily that we got a specific notice. Theoretically, we were allowed to be open the whole time. We're essential workers. We're physicians' office, doctors' offices have been open. We just waited until it seemed the safest, when we were starting to see protocols for reopening. Spent a lot of time looking into all of those things and trying to figure out a good and most importantly, safe plan for everybody. And we decided, okay, June 1st, we're going to reopen, but of course, and it's a whole new office now. And so we've opened June 1st. Now, in New York City, it is still illegal to do any cosmetic treatments. So we're doing only medical treatments, nothing elective, nothing cosmetic, and our, we've had a backlog. We've had patients who've been needing their treatments. They needed to be seen. So as of June 1st, we are pretty busy actually.
Right. And what procedures were you consulting for? Because I want to follow this up with telehealth. When did you start doing telemedicine? I mean, wasn't it kind of almost like a pie in the sky a year ago? Like, are you kidding?
Yeah, well, it's very interesting because, HIPAA, it seems, went out the window in a minute, whereas you could never use FaceTime or Zoom to see a patient, suddenly no problem, But within a couple of weeks, I'm very fortunate. I have a very good EHR system called Emma from Modernizing Medicine, and they came out with an integrated telehealth app, I guess, within 2 weeks or so, which is secure and all HIPAA compliant and so on. So I would say it took a couple of weeks to wrap our head around it for me and just to figure it out. But then we started offering telehealth visits, and pretty much people with rashes. We saw some acne patients, actually a fair amount of acne or Accutane patients. People were scared they had a growth. People were scared they had a COVID-related rash. So the truth is that I was fairly busy for a couple of months doing telemedicine.
How about telehealth on the cosmetic side?
So we did some, I did some consultations for that. But that is something that we were hoping now to use going forward, because if it's someone who has a plan to come in and do something day of, okay, but if they want a consultation, sure, let's set up a virtual visit. Happy to do the consulting and go from there. It's easy now. And also people's mindset is very different. Everyone hears about it. They know they can do it. So it's just something we're going to continue with.
So now when you did this, how did you promote it? Because, what happens is people go to your website.
Correct.
And in the very, very beginning, you were one of the first that was enrolled in our COVID-19 toolkit. And as you well know, we posted dozens of updates, and then we were posting 1 and 2, and Mara and I and our producer were creating policies and procedures and protocols and videos, and we had to date them. And when I did a video, I had to say, well, today is, because tomorrow Senate, Congress, the president, whatever, changed it. And
it's crazy, I know. Yeah, I mean, the truth is that Shorr Solutions, Anna, who's great, really got us going. I'll tell you, she helped us put together an e-blast, and she and our team, I should say, and we did that, and that was it. I mean, we were inundated. Our patients knew about it. The phone calls were nonstop. So, it was a concerted effort. Wanted to do it. I have a wonderful team beside me, and I don't think it would have happened, if I just on my own said, hey, come look at our website, and we posted it. But the e-blast and the word got out, and Instagram, we do a lot of that now. Again, we have a lot of help with that. So that's what got it going.
I'll get back to the actual operations of your practice, but I'd like to speak with you about the payroll protection program, because
Right.
this affected everybody.
Yeah.
Now, I remember we were speaking, if not every day, we were emailing every day, we were speaking every day, if not every other day, and it really didn't matter, times of the day. I guess my question to you is, Did the payroll protection program and how did the payroll protection program help to guide you with keeping your staff with layoffs and furloughs? Because we have clients throughout the country where there was a pandemic within the pandemic.
I was very, very fortunate, I must say. Through the bad, it was okay. I got through it. Speaking about the financial end of this, and yes, you and I texted and emailed and spoke on the phone because every day there was something new. And I did that with friends of mine in medical and dental practices. We were sharing information, forms to fill out, and so on. And so I actually got the PPP very early on, and I don't know, it just came through, and I was very shocked. And right before then, I know we had spoken, you and I, and my team is like my family.
Of
And
course.
initially I told them I would keep them on for X amount of time, but then it just wasn't going to happen. And when I had to tell them all, we met regularly on Zoom meetings while we were at home. When I had to tell them that they would have to go on unemployment, I was crying when I had to tell them that. And then 2 days later, the PPP came through. And then I just called them all up one at a time. I said, listen, we're good. You don't have to go on unemployment. I got you. And it enabled me to maintain my entire team throughout this. And the truth is, Jay, there's no way I would have gotten through this on my own. It just was not going to be possible. And even with you, I needed them, in the office. People would alternate, come in and do stuff. We were in touch constantly, and it was really an effort among all of us. So the PPP enabled me, and like as I said to them, when I told them I have to let them go, I said, we need an office to come back to. And the PPP and certainly your help got me through that. And it was just invaluable. It took such a burden off of my shoulders.
For sure. Did the change in the PPP from 75% payroll, 25% utilities lease
Right,
to the
right,
new change of 60%
right.
payroll and 40%, since you kept your staff anyway, did it affect you? Because most of the time, if you
No,
kept your staff, you were going to make that 75.
yeah, no, that's doesn't affect me at all. I was going to do fine with the original calculations. And again, I know you and I have spoken about this countless times, those calculations. Yeah. And it did not affect.
Good.
I'm okay with the way it was, the original one.
Good. How did you handle the telephones with the stay-at-home orders that you had? Because you had, people went onto your website, and if you're going onto the website, people want to come in. They don't care about the pandemic. So how did
Not
you?
only that, I'm sorry for interrupting. We've had several patients that were angry at us back in April. What do you mean I can't come in for my injection, for my Botox? I'm like,
Right.
do you understand what's happening here? But yeah, so it was, it was a lot on the fly. We sort of figured it out as we went along. Initially, we set up a system that gave me a lot more work, quite honestly, but it seemed to work. So all the calls went straight through to our answering service. It just seemed the easiest way. They immediately would email me the message, and then I would forward it on, depending, and believe me, all day it was nonstop. But we worked out a system among the team. I forwarded certain things depending what it was. If the patient needed a telehealth, we set that up. We worked it out. These were busy days for me, I must tell you. And I realized that I should keep regular work hours, because otherwise I could sit at the computer and do this work till 11 at night, So come 6, I said, that's it, no more, close the computer. And
Right.
weekends, I stopped that after a while too.
So a real important thing, we talk about PPP, now we talk about PPE.
Yes.
Now, Jay, the safety guy, has been dealing with PPE my entire professional career, all right? However, how are you marketing your safety protocols externally and then internally? Because what's important to me, if I'm going to come visit a doctor, and I have doctor's visits as well, but it is also important to me when I look to who that doctor is going to be is what protocols are you putting in place to make Jay, me, the patient, feel comfortable to see you?
Right. So again, as I mentioned before, we spent a lot of time. I mean, you on your website, your toolkit, there's a lot of information. I was online, we looked at the CDC and looked at the American Academy of Dermatology, New York, our medical malpractice company has a lot of information. And we looked at all the guidelines and how things should be done as properly and as safely. And as I tell my patients every patient that comes in, first and foremost, we wanted everybody in our office to feel safe. We want to make sure the health of our team and our families and our patients is first and foremost, and then we'll figure everything else out. So as we were getting started to reopen, we sent out, again, with your help, Anna helped us a lot on this. We sent out an e-blast. Patients responded immediately. We posted it on our website. We have it on Instagram. We have it on our appointment reminders. When patients get their reminders, it's part of that, both in text and voice. It's everywhere. And patients get calls and they know, we're doing all the things that are required to maintain the safety in our office. And we're very strict about it. There's no exception. No exception.
Yeah, you're such a young man like me. Did you ever think that social media, Instagram, Facebook would ever be something that you would be involved in your day?
I still don't know what those words mean, Jay. I got to be honest with you. Thank God for my team and your team, because I play. I have no idea. No, you know what? No, but you see, that's the thing. I love getting back to what you asked me before about cosmetics. I love adapting. I love the new stuff, so we learn it. And suddenly you realize, hey, wait a second. I can show them in my spacesuit PPE, my PAPR. Patients comment, they love it, and it just makes it more fun,
Yeah, what was not en vogue not even 4 months ago is so acceptable and actually embraced
Yeah, yeah,
today.
absolutely.
I do webinars and I'll do phone conversations, and we work virtually and we're working from home. And it's funny because I would always used to have to make sure. I have 4 parrots and they like to speak when I speak, right?
I've heard them.
Yeah. And it's okay now when you share, I'm working virtually, I'm working from home, and people are more readily acceptant today of what was. Even you in your NASA spacesuit that, with like
Right.
Dr. Castellano, as we mentioned,
Oh, yeah.
people would look at us like we're crazy if we walked around in gloves and masks, even externally, whereas today it's thank you.
Yes, that's correct.
I
The
really
patients
appreciate it.
love it. They're very happy that we're doing this,
So how has your staff adapted? Because, a lot of the staff in months past would always say, oh, doctor, it's too hot. Doctor, my hands sweat all the time in gloves. Doctor, my glasses fog up. I can give you every reason.
Right. Right. Well, listen, but they understand, obviously, at this point in time, we all want to be healthy and safe. But, we set up the office such that, I understood it was going to be difficult for my staff and team to sit up front with masks on all day long. So we have one of our exam rooms, is always going to be empty. And when someone needs 5 minutes, they just go take their mask off, breathe a little bit. We're trying to make it as comfortable as possible. Yet, we all, when we come in, each of us, myself included, we get our temperatures taken just like our patients. It's put in the logbook. We're very strict among ourselves. We won't allow, anything to pass without the guidelines. And they're okay. They're adapting. They understand. It's not a question. And
Going for right now, do you find that many of your calls have even started to swing back to more of a clinical derm side, or is it leveled off, or are you getting more of the cosmetic side? Because I
we're
hear it's all
getting
over the board.
Yeah, we're getting both. As I say, right now we're not allowed to do the cosmetics, but I'm told, and I haven't seen the schedule, I'm told that July for me is all cosmetics. That's it. We booked July, and with any luck, I have no idea who the powers that be are in where I live. It's between Mayor de Blasio and Governor Cuomo, who I know are not best buddies, so I have no idea who's in charge. But supposedly Monday, the 22nd, we go into phase two. Still not sure what that means. I've tried to find out how that affects my practice,
Right.
but no, but the calls are both. We're getting everything, to be honest with you. Yeah,
We'll stay out of the politics for the sake
I
of this.
tried to. Yeah,
Yeah.
fine.
Uh, Now, are you concerned that when you get this bolus and this rush of cosmetic patients that are going to jam your schedule as soon as you're allowed to open up? Because let's take that there are other doctors that are prudent and acknowledging the order. We all know that there are doctors out there that are
Of
disacknowledging the order,
course,
and
of course.
I don't want to talk about them. That's not what this is about.
Right.
They'll all get their due in one way or another. But the people that are doing what's allowed to be done, I've had this in Arizona, I've had this in Texas, and now we're having this in Florida for those that have opened up early already. Do you think that the bolus of patients are going to do this rush and everyone's going to think that I'm going to be so busy? How are you going to take that and level it off as the time comes? And then I want to follow it up.
Hmm.
Have any fear of this pandemic or a second round of this? Because I don't want to give opinions. I listen to scientists.
Right. So, yeah, I mean, listen, we're going to have the rush. My physician assistant does pretty much strictly medical dermatology. So she's very busy now. I think she's even busier than I am these days. So she's going to do whatever overflow. And I already told my team that, look, we're seeing one patient at a time. No one's in the waiting room. We're very strict now. We're not fitting anyone in. There's no double booking. But if people need to be seen, I said, look, I'm in the office at 7 in the morning. I can stay till whenever. I am happy to see people at the other ends of the schedule to accommodate everybody. Everybody's so afraid. There's so many worries right now. I don't want this to be a worry as well. If they can get into my office, if we can help them out, I'm happy to do that for them. You know, I have no idea what's going to be another round, I tell my patients all the time, there's one person I listen to, and that's Anthony Fauci. I think he's brilliant. He's not political. What he says, that's what I trust. So I don't know. I'm
Did you
just a
tell that?
dermatologist.
Did you tell that to your wife? There's only one person you listen to?
Her, of course. Who else? She knows. I said, you know what? God bless our wives because they allow us to think that we're in charge, but you know what? We know, they
I
know.
agree. I agree.
God bless them. Yeah.
So what PPE have you adopted as a permanent part of your practice? Even, let's say there's a vaccine tomorrow. What are you going to do with these PPE regulations that we have so adopted to believe as normal?
It's hard to know. I don't think we're just going to get rid of them overnight when a vaccine comes out because there's still going to be an unknown. Listen, when I started my dermatology practice, you couldn't get gloves because nobody was using them for everything, for procedures, skin biopsies, and then we just adapted to universal precautions, right? So I think this is going to be a game changer. I think we're going to still be very safe. I don't know if I'll be wearing a spacesuit, but I think we're going to be wearing masks and gloves for quite some time and limiting patient contact for quite some time, but we'll have to see how that plays out. But that's what I think. I think these things are going to be used like for a very long time. I don't see
No, I agree.
a change.
So what contingency plans do you have in place in the event that there is a second wave? I think I asked you this before, but
Yeah,
look, I've always talked about a plan, right?
right.
And the failure to plan is planning to fail. So with that being said, what contingency plans, if an event it doesn't happen, we're in good shape?
Yes. Here's the thing, I think that given the way we're operating in our office right now, I think we're good to go no matter what, in the sense that if there is a second wave, we can still see our medical patients if they want to come in. We're taking all the precautions, we're doing all of the right things. So I'm hopeful that we don't have to shut down again. And as a physician, again, doing medical visits, I don't think we'll have to shut down, but I don't, if patients want to come in, I believe we'll be able to function still, because we're just doing things differently and we're learning as we go along, and we're feeling more comfortable with all the precautions. So
Right.
I think we'll be all right. I think so.
Where are you getting your PPE from? Your regular vendors?
Oh my goodness. No, I'm getting them from anywhere that I can, to be honest with you. I go on websites every day. It's tough. I was able to, through the New York State Medical Society, hook up through the Plastic Academy, whatever it is, of plastic surgery. I've gotten some things there. Alaska, which is a derm company, Henry Schein has some things, whatever I can grab, I get,
Right.
It's very hard. As you know, it's very difficult now.
Couple of few questions.
Yeah.
I know that you attend different conferences for education for your CMEs, and we're all getting CMEs in a totally different way now. We're going online, we're reading, we're trying to get, things from questionnaires, but how has this affected you from going to the different conferences that we all commiserate at? And I have my own opinions. I'm on faculty of a dozen different conferences. Half of them have been canceled already. This is the mid-June. This is July already, really. It's June 18th. What do you think is going to be for the rest of the year?
Yeah, I think everything, I think for the most part, it's going to be virtual. I can't see people, I can't see major conferences. I, for one, am not going anywhere. I'm scared. I have to be honest with you. I can't see getting on a plane. I can't see, 1,000 or more people. The American Academy of Dermatology in March had 10,000 people scheduled at their conference, that was canceled. So,
Correct.
I think for the time being, this is the way to go. And again, we've all gotten comfortable with it, and it's not the same. We don't have that camaraderie. We can't, you can't network the same. It's very different, but it's very doable. We just had, in fact, again, getting the American Academy of Dermatology last weekend had their meeting virtually. They had a virtual meeting over the weekend, which is recorded, and you can see all the sessions now.
90% of all these conferences, the live training and everything is being done virtual.
Yeah.
I'm, like I said, Mara and I are on a dozen conferences a year, and we're just not, I'm not getting in a tube of recirculated air right now. I'm not traveling and things like that.
Yeah. No, I'm not going either. Yeah.
Do you think that your decisions in your practice because of COVID-19 are going to be different based on your medical knowledge versus the general layperson? Do you think of it as a doctor, or do you think of it as Michael Kurzman?
Well, I definitely think about Michael Kurzman a little bit more, because I am concerned for my listen, anything that goes on here, I bring home, so I have to think about myself, but that also means thinking about my patient, so what I do for myself, I do for them. So I think for the most part, it's just the medical decision making, and do things smartly, don't cut corners, and you're fine, just do it the right way each time,
Right. Do you have any closing comments, Dr. Kurzman, that you would like to share with our audience? As a medical professional for many, many years, how about any closing comments to the young ladies and gentlemen who are coming through medical school that don't know the way we are operating today? In their personal lives, they were just an undergrad.
Right.
But the young professionals today that are in medical school have yet to see internship and residencies. And of course, the way we're practicing today will be normal for them.
Right.
But
Yeah.
what advice do you have for them as
Yeah.
you and I are ending our careers, not any day soon, but sooner
Right.
than they are
Yes.
starting their careers? What advice do you have for
Well,
the young?
just to, first of all, enjoy what you're doing, and learn as much as you can, care as much as you can. This is a great field. There's so much to be done, and the future is still pretty good. I'm very hopeful, and so go with it. Just be a great, caring doctor.
What is the key to being a great doctor?
You have to be a great person first, I think. I know, but I'm still working on it. The doctor, I'm good at. The person,
It is truly an everyday work in progress.
oh yes, and
You
then
know,
some. Oh yeah.
so in closing, what would you suggest to people, and how could you comment in people's decisions to be able to determine whether or not they need third-party coaches and or a consultant in their business? A lot of people say, well, I can't afford it. I say you can't afford not to, but that's
I
very, very commercialized for me. What can you share in
Yeah.
your life
I,
about?
I I think I think everybody needs it. I don't think anybody can do this alone. And I think people experience is the key, and I know I'm good at being a doctor. I know I'm good at being a dermatologist. I know what my strengths are and I know what my weaknesses are. And it's very hard to accept that you don't think you can do it all. But when you find someone who understands this, has a lot of good experience, is easy to work with, and truly cares, just attach yourself to that person and never let go. It's the best thing because your life becomes so much better on a lot of levels, you know. So
Well,
I think it's crucial, and I'm only sorry that I didn't figure this out sooner, truthfully.
good. Well, ladies and gentlemen, I certainly appreciate the time that Dr. Kurzman has taken with us today to share his personal experiences, his life, his daily living in this new normal, which we consider to be the normal. This is going to be in a series. This will be posted online. We will share the link that you can see it on our website. You'll be able to see it on Dr. Kurzman's website. We will have this on social media. Our contact information is www.shorr, SHORR Solutions, plural, because we have more than one solution.com, shorrsolutions.com. Our social media handle is at Shorr Solutions on Twitter, Instagram, and Facebook. And we'd like to thank you once again, Dr. Kurzman, for taking a part out of your
Yeah.
busy day. And we look forward to sharing more of our pearls with you. You can see us all online. If you're interested, please contact us, info@shorrsolutions.com. Thank you, everybody. Take care now.